Hey everyone, welcome back to another deep dive. I know you guys are all probably super busy with your nursing studies, so we're going to jump right into something I'm sure you've been digging into lately, providing psychosocial and spiritual care to patients in a psychiatric setting.
Oh, yeah. That's a huge part of psychiatric mental health nursing and a really fascinating topic to dive into.
It is, and we're going to be taking a deep dive into Chapter 11 of Psychosocial and Spiritual Care in Psychiatric Nursing, which is part of the Davis Advantage for Psychiatric Mental Health Nursing textbook.
Hi, sounds like a plan.
But this isn't going to be just, me reading the chapter to you or anything like that. We're really going to explore the why behind these interventions.
Yeah.
Like how does all of this actually impact patient care?
Yeah, getting into the practical application is key because it's one thing to understand the theory, but it's another to actually see how it plays out in real-life nursing.
Exactly. And, luckily for us, we've got you here to help us break down some of these trickier concepts and really, connect the dots between the textbook and what we're going to be doing as nurses.
Well, I'm happy to share what I know, and hopefully we can all learn something new along the way.
Awesome. So one of the first things that really struck me when I was reading this chapter is this idea that medication, while obviously a super important part of psychiatric care, isn't the whole story.
It's so true. The chapter really emphasizes that psychosocial interventions are just as crucial because they help patients develop those coping skills, build resilience, and ultimately improve their overall quality of life.
It's like, imagine you've got a patient who's struggling with social anxiety.
Yeah.
Medication might help manage some of those physical symptoms,
Yeah.
like, the racing heart, the sweating, but it's those psychosocial interventions like social skills training that can give them the tools to actually navigate those social situations and feel more confident.
Absolutely. And it's about recognizing that recovery isn't just about symptom reduction. It's about helping people live full and meaningful lives.
Okay, so speaking of psychosocial interventions, the chapter talks a lot about CBT or cognitive behavioral therapy.
CBT is like one of those foundational therapies in mental health because it directly addresses those thought patterns and behaviors that can contribute to or even maintain mental health challenges.
So it's not just about talking about your feelings, it's about learning to identify and change those unhelpful thought patterns and behaviors.
Exactly. It gives people a framework for understanding how their thoughts, feelings, and behaviors are all interconnected.
And the chapter emphasizes that CBT is evidence-based, right? Like there's a ton of research to support its effectiveness for a whole range of conditions.
Oh, yeah, for sure. It's been proven effective for things like depression, anxiety, PTSD, substance use disorders. The list goes on.
And one thing that I found really interesting is that CBT can be adapted to meet the specific needs of each patient.
Oh,
Yeah.
absolutely. It's not a one-size-fits-all approach, and that's one of the reasons it's so effective.
So, for example, a patient with social anxiety might work on challenging those negative thoughts about social situations,
Right.
while someone with depression might focus on identifying and replacing those negative core beliefs that are fueling their low mood.
Exactly. And that's where the real power of CBT lies.
Mm.
It empowers patients to become active participants in their own recovery.
It gives them the tools and strategies they can use long after therapy has ended.
And those skills can be applied to so many different areas of their lives.
It's really about equipping them to handle whatever challenges come their way.
Okay, so we've talked about CBT, but there are also a whole bunch of other supportive therapies that the chapter highlights.
Like what?
Well, there's psychodynamic therapy, motivational interviewing, interpersonal therapy. They all kind of delve into different aspects of a patient's experience, but they all share that common goal of providing support and promoting self-awareness.
So how do you know, like, which therapy is right for which patient?
Well, that's where a good assessment comes in. It's about understanding the patient's history, their current struggles, their goals for therapy, and then tailoring the approach to meet those specific needs.
It makes sense that there wouldn't be just one magic bullet solution.
Definitely not. It's about finding the right fit for each individual.
Now, besides individual therapies, the chapter also talks about social and occupational interventions, which I think are super important because they really address that bigger picture of a person's life.
Absolutely. Things like family therapy and vocational rehabilitation play a huge role in helping patients reintegrate into their communities and achieve their goals.
So, for example, if you've got a patient with bipolar disorder who's struggling with family relationships, family therapy can be so helpful in improving communication, understanding, and reducing that stress that can sometimes trigger a relapse.
Exactly. And vocational rehab can help patients develop job skills, build confidence, and find meaningful employment, which can be a huge boost to their self-esteem and overall well-being.
It's about creating a supportive environment that sets them up for success, both personally and professionally.
It's that whole holistic approach, recognizing that mental health is intertwined with every aspect of a person's life.
It's not just about treating symptoms in isolation, it's about supporting the whole person.
Right, and I think one quote from the chapter that really sums this up is, recovery is not merely the absence of disease, but the attainment of a full and meaningful life.
I love that quote. It really shifts the focus from just surviving to thriving.
And it highlights the fact that recovery is an ongoing journey, not a destination.
And as nurses, we have the privilege of walking alongside our patients on that journey, providing support, encouragement, and guidance every step of the way.
It's a pretty amazing role to play.
It is. And, speaking of supporting the whole person, the chapter also delves into the importance of spiritual care.
Ah, yes, spiritual care. It's often overlooked, but it can be such a powerful source of strength and healing for patients.
I think it's an area that a lot of nursing students might feel a little bit hesitant to approach.
Yeah, it can definitely feel a bit intimidating, especially if you're not sure how to navigate those conversations.
But the chapter emphasizes that spiritual care is an essential component of holistic nursing care.
And it's not just about religion, it's about addressing that deeper human need for meaning, purpose, hope, and connection.
So even if a patient doesn't identify with a specific religion, they might still have spiritual needs that we need to be aware of and sensitive to.
Absolutely. It's about recognizing that spirituality is a unique and personal experience for everyone.
So I think that's a perfect place to take a break. And in part 2, we'll delve deeper into the specifics of providing spiritual care in psychiatric nursing.
Sounds good to me.
All right, we'll be right back after a short break. All right, so we're back and ready to dive into spiritual care, which, as we were saying, can be a bit of a tricky area for nursing students.
Yeah, I remember feeling a little unsure about it when I was in nursing school. Like,
Yeah.
you're dealing with people's deeply held beliefs and values. It can feel a bit like walking on eggshells, you know?
I totally get that. And, the chapter kind of acknowledges that. It says that some nurses might be hesitant to address spirituality for fear of, offending someone or overstepping boundaries.
Yeah, which is understandable. But the chapter also makes this really important point that it's actually part of our ethical responsibility as nurses to address the whole person, and that includes their spiritual well-being.
So how do we do that in a way that's respectful and sensitive to each individual's beliefs?
Well, the chapter gives some really good guidelines. It starts by emphasizing that spiritual care doesn't have to be about religion.
Oh, okay, so it's broader than that.
Much broader. It's about recognizing that we're all searching for meaning and purpose in life. And that can be especially important when someone's going through a tough time, like dealing with a mental health challenge.
So even if a patient doesn't identify with a specific religion, they might still have spiritual needs that we need to be aware of.
Exactly. It's about that human need for a connection, for hope, for something bigger than ourselves.
So how do we actually assess those needs?
Well, just like with any other assessment, we ask questions. But these questions are a little different, you know? We might ask things like, what gives your life meaning? Or what are your sources of strength and hope?
Those are good questions.
And it's important to really listen to what the patient's saying and not try to impose our own beliefs or interpretations on them.
It's about meeting them where they are and respecting their individual journey.
Exactly. And sometimes that might involve connecting them with resources like a chaplain or a spiritual counselor if they're open to that.
But sometimes it might just be about being a compassionate presence, offering a listening ear, and acknowledging the importance of their spiritual struggles.
Sometimes just feeling heard and understood can make a world of difference.
So true. Now, the chapter also talks about spiritual distress, which we touched on briefly earlier. Can you explain a bit more about what that is and how we can recognize it in our patients?
Sure. So spiritual distress is basically when someone's experiencing a crisis of faith or a loss of meaning and purpose. It can manifest in a lot of different ways, like questioning their beliefs, feeling angry or abandoned by a higher power, or just feeling a sense of emptiness and despair.
And that can be really tough to deal with, especially when it's coupled with other mental health challenges.
Absolutely.
Hmm.
And as nurses, we need to be able to recognize those signs and offer support, even if we don't have all the answers.
So we don't have to be spiritual gurus.
No, not at all.
Yeah.
Sometimes the most important thing we can do is just be present, listen with empathy, and validate their experiences.
And if we're feeling out of our depth, we can always consult with a chaplain or another member of the healthcare team.
Exactly. Teamwork makes the dream work, right?
Right. And, speaking of teamwork, I think it's important to remember that self-care is a crucial part of providing spiritual care.
Oh, for sure. We can't pour from an empty cup.
If we're going to be present and supportive for our patients, we need to be taking care of our own spiritual well-being too.
Absolutely, whether that's through meditation, prayer, spending time in nature, whatever brings you a sense of peace and connection.
It's about finding those practices that nourish your soul and help you stay grounded in the midst of all the challenges of nursing.
Because let's face it, this work can be emotionally draining.
It can. And if we're not taking care of ourselves, we're more likely to experience burnout and compassion fatigue, which can ultimately impact the quality of care we're able to provide.
So self-care is not selfish, it's essential.
I love that. And it's something we can model for our patients too.
Exactly. Showing them that it's okay to prioritize their own well-being.
It's all part of that holistic approach to care.
All right, so we've covered a lot of ground in terms of spiritual care, but there's another piece of the psychosocial puzzle that we need to talk about.
Look at this.
Social and occupational interventions. These interventions are all about helping patients connect with their communities, develop meaningful roles, and basically build a life outside of the hospital.
Okay, that sounds really important. So let's dive into that in part 3. Okay, so we're back and ready to talk about those social and occupational interventions you mentioned. They sound like a really important part of helping patients, actually live their lives outside of a hospital setting.
Oh yeah, they're super crucial. It's all about recognizing that mental health is so intertwined with, someone's social life, their sense of purpose, and just their ability to function day to day.
Right. It's like you can't just treat the symptoms in isolation. You have to consider the whole context of their life.
Exactly. So one of the big interventions the chapter talks about is family therapy.
Family therapy. Okay, I've heard of that one.
Yeah, so basically it involves working with the patient's whole family to address any dynamics that might be, either contributing to or exacerbating the patient's mental health challenges.
So it's about recognizing that families are like systems.
Yeah, exactly. Like a system where if one part is off, it can throw off the whole balance.
And it's not about blaming the family or anything like that.
No, not at all. It's more about recognizing that families can sometimes, unintentionally fall into unhealthy patterns.
And I guess family therapy can help them break those patterns and develop healthier ways of interacting.
Yeah, exactly. It can help them improve communication, learn how to set boundaries, and ultimately create a more supportive environment for everyone involved.
That makes sense. And the chapter talks about how family therapy can be especially helpful for patients with schizophrenia.
Oh yeah, definitely. It's been shown to significantly reduce the risk of relapse for those patients when their families are involved in the treatment process.
Wow, that's huge. And I think it makes sense because family support can be so crucial for someone with a serious mental illness like schizophrenia.
Right, and it's not just schizophrenia. Family therapy can also be really beneficial for patients with eating disorders.
Oh, right, because family dynamics often play a role in those disorders too.
Exactly. It can help families understand the disorder better and learn how to support their loved one in a healthy way.
So family therapy is like a multifaceted tool.
It is. It can address so many different levels of a patient's experience and really make a difference in their overall well-being.
Okay, so we've talked about family therapy, but what about those occupational interventions? What exactly are those?
The occupational interventions are all about helping people engage in meaningful activities that give them a sense of purpose and accomplishment.
So it's not just about like finding a job.
No, it's broader than that. It's about identifying activities that the person actually enjoys and that help them feel like they're contributing to something.
So it could be like volunteering or taking an art class or joining a sports team.
Yeah, exactly. Anything that brings them joy and helps them develop skills and connect with their community.
And I imagine this can be really helpful for people who are struggling with motivation or who have lost interest in things they used to enjoy.
Oh, absolutely. It can help them rediscover their passions and start rebuilding their lives.
And I'm guessing this is something that's individualized to each patient.
Of course. It's all about tailoring the interventions to their specific needs and interests.
So for someone with depression, it might be about helping them reconnect with activities they used to love.
Right, and for someone with anxiety, it might be about teaching them relaxation techniques and coping skills that they can use in their daily life.
And for people with more severe mental illnesses, it might even be about helping them with basic life skills, like cooking or managing their finances.
Exactly. It's all about meeting them where they are and helping them build the skills they need to live fulfilling and independent lives.
This is all making so much sense now. I feel like I finally have a grasp on what psychosocial care really means.
Yeah, it's definitely more than just meds and therapy. It's about addressing the whole person, their social world, their occupational needs, their spiritual beliefs.
It's about recognizing that all of these things are interconnected and that you can't really separate mental health from the rest of a person's life.
And that's what makes it so challenging and so rewarding at the same time.
Well, I don't know about you, but I feel like I've learned so much from this deep dive.
Me too. It's always good to refresh our knowledge and really think about how we can apply these concepts in our nursing practice.
Absolutely. And to all of our listeners out there, thanks for joining us on this journey into the world of psychosocial and spiritual care. I hope you found it as enlightening as we did.
And remember, this is just the tip of the iceberg. There's so much more to learn and explore in this field.
So keep reading, keep asking questions, and keep striving to provide the best possible care to your patients.
Because at the end of the day, that's what it's all about.
Well said. All right, that's a wrap for this episode of The Deep Dive. We'll see you next time.